Today, we're diving into something truly, genuinely groundbreaking. When we talk about breakthroughs in healthcare, we often imagine new medications, new vaccines, new treatment strategies. But sometimes, the most revolutionary innovations are the ones that change how people access healthcare, how fast they get answers, and how privately they can get those answers. And that's exactly what we're exploring today. The recent FDA approval of the Insti 1-minute HIV self-test. Yes, you heard that right. A self-test you can use in the privacy of your home. That delivers a result in just 60 seconds. This isn't just another upgrade or a slightly better version of what existed before. This is a massive shift in HIV diagnosis, one that removes decades-old barriers almost overnight. So today, we're going to unpack everything. How this test works, why the 60-second result is not hype but real science, why its accuracy data is frankly jaw-dropping, and most importantly, what this means for public health in the US and thousands of people who are currently living undiagnosed. Right, and this approval from the FDA really is a turning point. When you look back across the last 40 years of HIV history, we've made incredible progress, but the biggest challenges persist. Social stigma, fear of being seen at a clinic, limited access in rural areas, financial constraints, or simply not having the time. These issues create enormous gaps in who gets tested. This new test changes that. It shifts the power back to the individual. It makes HIV testing something you can do privately, comfortably, and confidently. Let's start with the part that grabs everyone's attention immediately. The test claims to deliver results in 1 minute, 60 seconds. That sounds almost unbelievable. Is that accurate? It genuinely is. The Insti test uses a sophisticated flow-through technology that moves incredibly fast. Instead of waiting for a reaction to develop, like with many rapid tests, this platform pulls the sample through the membrane rapidly, giving you visible results almost instantly. And the procedure is intentionally simple. This is important because complexity kills adoption. But here, all you need is one tiny drop of blood from your fingertip. Just one, that's it. So the test is designed not just to be fast, but to be simple even for someone without any medical background. And that simplicity is intentional. The company behind it, Biolytical, has repeatedly emphasized that this is about far more than convenience. It's about empowerment. Exactly. Biolytical's CEO, Robert Mackey, uses that word empowerment over and over. And it makes sense. For decades, testing required appointments, waiting rooms, lab results that take a week or more, and a lot of emotional energy. With this test, all of that goes away. You don't need to ask for time off work. You don't need to commute to a clinic. You don't need to worry about who might see you walk inside. You don't need to sit anxiously for days waiting for results. You get control. You get privacy. You get privacy. You get answers in 60 seconds. And that privacy is life-changing for many people. Let's talk about the barriers this test directly dismantles. Based on all the data, we consistently see three major ones: stigma, cost, and location. Let's start with stigma. For far too many people, HIV testing still carries shame or fear of being judged. Even the simple act of walking into a clinic can feel incredibly exposing. You may worry someone will see you or assume things about you. And that fear alone keeps people away from testing. Exactly. And then there's the logistical reality. Someone living in a rural area might be over an hour from the nearest clinic. Someone working 2 jobs may simply not have the flexibility to go during clinic hours. Testing sometimes means losing income or spending money you don't have. But this 1-minute self-test eliminates all of that. You can do it at home, in your bedroom, in your bathroom, in the privacy of a hotel room while traveling. No transportation cost, no judgment, no scheduling, no waiting. And that's why this test is so powerful. It removes every major barrier at once. It's not just faster, it's accessible. And accessibility is what expands public health. Biolytical's VP of Scientific Affairs, Anna Subramanian, put it beautifully. The FDA approval reflects the scientific integrity of our work and our commitment to expanding access to rapid, reliable diagnostics. So, let's talk about the science. Because speed is fantastic, but speed alone doesn't matter without reliability. How accurate is this test? This is where things get truly remarkable. In the clinical studies submitted to the FDA, sensitivity was 100%. 20% specificity was 100%. Those numbers are extremely rare. What this means in practical terms is simple. If you have HIV, the test detected it every single time. If you don't have HIV, the test correctly showed negative every single time. No false positives, no false negatives. This is almost unheard of in diagnostics. And just to be clear, this wasn't compared to some outdated test. This was benchmarked against a fourth-generation HIV antigen antibody lab, test one of the best and earliest detecting laboratory methods available. Exactly. Fourth-generation tests detect both antibodies and the P24 antigen, an early marker of HIV infection. That means they catch infections earlier than older tests. And the Insti self-test matched that standard in the studies. A 1-minute test delivering results comparable to a high-level lab test. That's huge. And the technology isn't new or untested. The WHO actually pre-qualified this test back in 2018. Biolytical has FDA approvals, Health Canada approvals, and WHO validations for earlier versions of this technology. So the foundation is already proven. And importantly, people found the test easy, very easy. In user studies, 95% of people said the test was simple to use, simple to understand, and simple to interpret. And 95% said they would use it again or recommend it to family, friends, or partners. That level of acceptance is incredibly rare. That really shows trust, which is essential for adoption. So now, let's zoom out and look at the bigger picture in the US. There are nearly 1.2 million Americans living with HIV. And every year, more than 30 new infections occur. But here's the statistic. This test is directly designed to address 13% of people living with HIV do not know they have it. That's more than 150 people. These individuals, often because of stigma, cost, or lack of access, don't get tested, they don't get treatment, and they often unknowingly transmit the virus to others. This test could change that, absolutely. And this aligns perfectly with the US ending the HIV Epidemic initiative. The goal is ambitious: reduce new infections by 90% by 2030. To hit that target, we must diagnose people earlier. And the initiative is built around 4 pillars: diagnose, treat, prevent, and respond. This 1-minute self-test supports all 4. Exactly. Earlier diagnosis means earlier treatment, and earlier treatment means better health outcomes. People live longer, healthier lives. And it means something even more powerful. When someone is on effective treatment and reaches an undetectable viral load, they cannot transmit HIV. This is the principle known as U equals to U, or undetectable equals untransmittable. So a faster diagnosis doesn't just help the individual, it protects the entire community. And that's why this test is genuinely transformative. It puts diagnosis, one of the most crucial steps, directly into the hands of the people who need it most. So as we come to the end of today's episode, here's something to think about. If a 1-minute, highly accurate, completely private self-test can revolutionize HIV diagnosis, what other areas of healthcare could benefit from this model? Where else do stigma, fear, inconvenience, or geography prevent people from getting tested or getting answers? This single innovation could be the blueprint for the future of diagnostics across many other conditions. Thank you for joining us today on the HIV RNA Test Guide podcast. We hope this deep dive has been informative, eye-opening, and thought-provoking. Stay tuned for more insights as we continue exploring the evolving world of HIV.